At the air ambulance base, paramedics have been called to an explosion at a warehouse in Kyneton, 90 kilometres northwest of Melbourne. A 30-year-old worker has suffered serious burns to the face and arms, a situation Micah flight paramedic Matt knows could be critical.
So we're going to a young male who's sustained some facial burns, which is a big concern to us. My concern is with facial burns that they deteriorate, their airway will swell, it'll close over and the patient won't be able to breathe.
With such potentially life-threatening injuries, the patient will need to be thoroughly assessed before he's transported to a burn centre. But the weather report is showing a problem.
Is that what's coming?
A band of storm clouds is moving in. If the team can't get in and out quickly, they may not be able to make the return trip at all.
We're not going to beat the shells, are we?
We're going to be quite tight for time when we get on the ground. Yeah.
We're effectively flying into a large rain band that's coming straight towards us. So my aim at this point is to perform a rapid assessment of the patient to determine his level of injuries. But it's doubled the pressure on whether I can stay and intervene or whether I need to just package him as quickly as possible and return back to the burn centre with him.
A local ambulance crew has been treating the patient and is now waiting at the helicopter landing site. Now Matt needs to establish the extent of the man's burns.
Hello.
G'day.
How you going? How are you? Hello, mate. How are you?
Oh, not too bad.
Danny.
Danny, pleased to meet you, mate.
Basically, there was a barbecue going on and there was a spray can of oil next to it. Too close, really hot, exploded.
Spray can of oil, like just a olive oil type
oil,
thing? Yeah. Yep.
Right next to it.
Okay.
So his face has got superficial burns. You can see the singeing of the hair and the eyebrows.
The guys at scene give me a short handover on what's actually happened, and I can see quite clearly he's sustained significant burns to his face. He's lost his hair on the side of his head, his forehead, his eyebrows, his eyelashes.
He said the flames went right around his face and head. Felt like he might have got a little bit into his lungs too.
Yep.
There is some redness and maybe a little bit of swelling at the back of his tongue.
More specifically, I become extremely anxious with people with airway burns. They have the potential to rapidly deteriorate to the point that we have to perform surgical airways on them by cutting holes in their neck. I'm very concerned about him.
I'm just going to have a listen to your chest, so I'll get you to take some nice big breaths. You can keep going with the water if you want.
In country Victoria, air ambulance paramedic Matt is assessing Danny after an explosion at a workplace barbecue.
He's had 15 milligrams of morphine and 12.5 of Stimatol.
No worries.
With bad weather forecast, Matt urgently needs to get his patient into the air ambulance and to a Melbourne burn centre. But he's worried Danny's scorched airway will need treatment first.
Open up your mouth, stick out your tongue for you, stick it out, nice and just open your nose. So you keep going, you're right, just breathe normally, mate.
So the irony of this whole situation is Danny is having a WorkSafe meeting at his place. He's having a barbecue to finish off the day, and they have an olive oil spray can which all of a sudden has exploded. With Danny, I'm concerned that maybe that sudden release of air has caused his lungs to actually collapse.
And your lips, are they sort of...
Yeah.
So Danny was thrown backwards from the explosion. He couldn't see initially. He's in severe amount of pain. The first thing he does is sticks his head in a bucket of water. So he's been exposed to a significant hot force here.
While he has sustained some burns to his airway, Danny's breathing is stable enough for him to travel. But with the storm now moving in, Matt's running out of time to get him airborne.
Righto, we're going to do this quick, so literally bed out and we're going to swap you straight across and get you moving.
So I've assessed Danny and I established that his airway is okay, but now I'm concerned about the weather. The weather's closing in on us. We need to get a move on with getting him to hospital.
Right, mate. So a quick flight back to Melbourne. It'll be about 15 minutes of actual flying time.
I'd normally get an umbrella out for you, but I reckon you're enjoying it.
Fortunately for Danny, the rain starts to drizzle down on him and he's got cool fluid coming onto his face, so he's probably enjoying that moment of relief he gets there.
The cloud base is fairly high. It's just this light suspended rain that's making the viz come down a bit.
With its cooling effects, so far, the weather has helped more than hindered. And as the flight gets underway, a saline drip helps soothe Danny's burns.
You want any more pain relief? No, it's not too bad. It only hurts when I pull this away from it. Yeah, no worries. Nothing beats the feeling of having cool water running over a burn after you've had an injury.
But although his pain is manageable, Danny's situation is precarious.
Danny has been exposed to a significant heat source here, but it's not just the flames I'm concerned about. It's the shock waves that are associated with an explosion. So you can penetrate and burst or rupture internal organs, eardrums, and those sorts of things. So I can never be 100% sure about what's actually going on until you've had all the diagnostic tests at the emergency department.
How we going, Danny? We're at the Alfred Hospital, mate.
Danny's future is uncertain. But as he arrives at the burn centre, at least the weather is still being kind.
So that cool breeze is probably nice.
Yeah, that's real good, man.
Yeah. So a few bumps as we come out, mate.
See you, mate.
After a can of spray oil exploded at his work barbecue, Danny was airlifted to Melbourne's Alfred Hospital. No internal injuries were detected, and he was released a few days later with second-degree burns. Danny's now recovering, and the good news is his hair, eyelashes and eyebrows are all growing back. Also on the Saturday night shift is Mark and his partner, fellow Micah paramedic, Karina.
32-year-old unconscious lady. Well, it says sleeping, so I assume she's breathing.
Their first case is an emergency at a bus stop.
Maybe heroin if we're in a bus stop, are we thinking?
It's late in the evening, a young woman asleep on a bus. Initially, you first think, oh, I wonder what's going on here. I hope there's nothing hideously wrong with her. There's obviously a large spectrum of things that can be wrong.
G'day, how you going? Are you the bus driver, are you?
Yes, yes.
Can you just tell us what's going on, please?
She was completely asleep when I pulled in, and she was not responding.
Okay.
Bus driver Keith, at the end of the line, is nervous about his unresponsive passenger.
Was she in that position as we see her?
It took her about maybe 5 minutes just to get her like that.
Righto, to respond.
Yeah. My first reaction was a heart attack, or a person was bashed and they were unconscious. We don't know. When I saw the ambulance, it was a sign of relief because I realised help was here and they knew what they were doing.
G'day, how you going? What's your name?
Beth.
Sorry?
Beth.
Rebecca, is it?
Rebecca, you're with Mark and Karina from the ambulance.
So the first thought is always, does she have some sort of past history? Does she have seizures? Does she have, diabetes? Is she having a hypoglycemic episode? Is there something seriously wrong?
You able to sit back in the chair so we can see your face? Where have you been tonight? You're in Clifton Hill at the moment. Sorry?
Mark and Karina are still cautiously assessing their patient, Rebecca, found unresponsive on a bus at the end of the line.
Rebecca, do you mind if we sit you back so we can have a better look at you, please?
Yeah, that's fine.
But suddenly, she springs to life and is surprisingly happy to chat.
You normally fitting well?
Yeah, hope so.
How much booze have you had tonight?
4 pints.
4 pints?
Yeah.
Finally, we do get a response from her, and that's very relieving. She's a POM, she's over here travelling, she's had a fabulous evening. She's talking like there's no tomorrow.
Yeah.
Do you have any food with your pints or just...
No, just pints. They're very little, no pint size myself, but...
You've got no diabetes or any other history of medical problems? No, that's right.
No, I don't.
It becomes very clear very quickly that we don't need to worry. She goes from being almost unconscious asleep to being very chatty. They must have been 4 very big pints.
I'm normally don't drink on a Sunday, but it's the Queen's birthday. She's my grandma, so I do really not to.
The Queen's your grandma?
Yeah, I know.
So clinically, medically, Rebecca's very stable, but my best description of her would be sublimely relaxed.
I'm ticklish, sorry.
You haven't used heroin at all?
No, oh God, no. All I remember is having one too many beers, getting on the bus, and I had a dream that I was giving CPR to a fish. And every time I gave the fish CPR, I could taste the fish. And I was blowing into it and it was going into a puffer fish. And then I was giving it the whole like chest pumping thing. And I realised, okay, fish don't have lungs, it's not gonna work. And then I burst into life and swam away and I was like, that's my good deed done for the day. I'm amazing. It was a great dream.
For all of the seriousness of our job, occasionally you come across a personality that's just great to interact with. And Rebecca is one of those people.
Thank you so much, by the way. Thank you so much. That's really nice of you to check up on me. Come on, give me some loving. Come on. That's very nice of you. Thank you so much.
Oh, no worries. I'm just glad you're okay.
So with Rebecca sorted and ready to head back out on the town,
All these young people out here having fun.
our two hard-working paramedics are definitely starting to feel like they may be missing out.
Look at all that wine, Karina.
Why are we not sitting on a deck somewhere eating blue cheese and drinking wine?
Oh.
It's torturous.